Hi friends, this is Dr. Abdul Kaim Chumthanawala. Today let me give you some insight of symptoms which I have found very useful in the treatment of this pandemic. And these symptoms I have seen a lot of patients and confirmed this in a lot of patients and have got very good results if this symptom is present in this pandemic. The remedy which I am talking about is a simple remedy, that is phosphorus. I know you everybody know about the phosphorus, but I'll share only the symptoms which I have found very useful in this pandemic and the symptoms which I have got for the patient and the remedy fits. And those symptoms, the first symptom is that the cough of phosphorus is because of I would say wind on the chest. जब भी पेशेंट बोलता है कि छाती में ठंड लगी बहुत जम से और खांसी शुरू हो गई, you have to remember phosphorus is the very important remedy in this case. That means cold cough, cold wind on the chest. So there's cold wind on your chest and the cough starts. You have to remember two remedies in fact. First is of course phosphorus, and very close to phosphorus, one of the very important remedies, that is Rumex. Rumex crispus. In phosphorus, if somebody asks you खांसी कैसे, how is the cough, and the patient tells you, डॉक्टर साहब सवेरे और रात दिन भर खांसी चलती रहती है, the night and day I'm coughing. That is the cough of phosphorus, my dear friends. Constant cough day and night. Compare this phosphorus cough with Lycopodium, Spongia, and Squilla. These three remedies have given me very good results when the patient complains that there is cough day and night, and that is an indication of phosphorus or Spongia or Squilla, and sometimes it can be for Natramine also. Third thing, if you ask the patient कि आपको खांसी exactly कब शुरू होती है, so if he is a phosphorus patient, he'll tell you, sir, when I come evening में जब घर आता हूँ काम काज से, when I come home in the evening and the cough starts and the cough stays until midnight, and after midnight it is better. These are the wordings of a phosphorus patient. Cough starts in the evening until midnight. So with phosphorus, do remember Hiparsulf and Rustox, both these remedies. In fact, there are three remedies more, but three remedies, that is phosphorus, Rumex, and Hiparsulf, I have found very useful in this condition. Next, if there is cough around midnight also, dry cough around midnight also, don't always think about arsenic. Do think about phosphorus also. In fact, phosphorus, Nux vomica, and one of the very important remedies in a patient who came and told me, he was an old patient, lot of rattling in chest, and the cough was around midnight. And I gave that patient ammonium carb. So ammonium carb, phosphorus, Nux vomica, three very important remedies when there is cough around midnight. And as I told you, the dry cough of phosphorus is basically aggravated from, or it is because of cold air. Whenever the patient comes and tells you the cough is dry from cold air, ठंडी हवा की वजह से अगर खांसी आती है पेशेंट को, माय डियर फ्रेंड्स, सबसे पहले ध्यान रखिए phosphorus, काली कार्ब, Squilla, and a very important remedy. In fact, I would say more important than phosphorus, and that remedy is, yes, it is Senega. When I teach Senega, I'll tell you in which patients I have used Senega in this pandemic, and I have got very nice results where most of the remedy failed and Senega worked. As you go further in phosphorus, of course, there are other causes of cough in phosphorus which I will not discuss. I'll only discuss the pandemic symptom which I have got very useful in phosphorus case. Next, as you go further in phosphorus, it is written that the cough where hot application ameliorates. This is a very important symptom where the cough is better by hot application also. The patient comes and tells you, गरम सेक करता हूँ, गरम ये लेता हूँ तो मेरे को काफी अच्छा लगता है खांसी में, and that is a very important indication of phosphorus, Hiparsulf, Rustox, Rumex, Cilicia. So see, whenever we are discussing phosphorus cough, very close it is coming Hiparsulf, very close it is coming Rustox. So these remedies have only minor differentiation, and if you know this differentiation, you will be able to treat a lot of cases in this pandemic. So I would say cold air aggravation, so remember phosphorus. And there is a important symptom of phosphorus that the patient has a very irritable type of cough in the night. That is very close to phosphorus is tuberculinum. Again, very close to phosphorus, tuberculinum, Rustox, Hiparsulf. These three remedies are coming very close together. Hence, try to differentiate this. Now, if the cough of phosphorus is loose, if the patient complains of loose cough, so it is not always dry cough. Phosphorus also has loose cough. Now, when is the modality of this loose phosphorus cough is also very, very important. In phosphorus, loose cough after eating, a very, very important symptom. The patient आके बोला डॉक्टर साहब वैसे तो खांसी ठीक है, जब भी खाना खाता हूँ ना खाना तो खरखर खरखर छाती में आ जाती है. Loose cough. Don't always think about Entemtard or Senega or Arelia. Think about phosphorus. Loose cough after eating. A very important remedy, phosphorus. Do think about maybe Silicea, Staphylococcus or Thuja also. But phosphorus comes the first remedy when there is lot of rattling cough or loose cough immediately, or it is called loose cough after eating. This is important because ये पेंडेमिक में काफी लोग आएंगे, जैसा भूख लगी खाना खाए लेकिन फिर खांसी खरखर आ जाती है. Think about phosphorus. This is a very, very important symptom of phosphorus. Now, in relation to ladies also, I must say one symptom of phosphorus that is very important, that is phosphorus cough is aggravated at the beginning of menses. This you have to remember because it's a very, very important symptom of only two remedies I have seen, which acts very nice in clinical practice. That is, one is phosphorus and the second is senescence. Menses aggravated cough at the beginning of. So this symptom of these two remedies are important because we have to differentiate if this is specific symptom is present in the patient. Now, और एक symptom है, one symptom where the patient is, I had a case where the patient was studying in his room and whenever somebody used to enter the room, he used to start getting cough. Whenever he is working and somebody is around him, somebody is coming and he knows that somebody is coming, so the phosphorus cough starts in that case also. That is called as nervous cough. Beautifully written in Amateur Medica. Nervous cough, if anybody enters the room and if this symptom is there and if you do not know what to prescribe but this symptom is very particular, my dear friends, give phosphorus and see the very, very important results of phosphorus in this symptom. In fact, if the patient tells you that मेरे घर पे मैंने अगरबत्ती जलाया, धूप जलाया, and somebody has put perfume and you start getting cough, in that also it is written in Amateur Medica, strong odor and the cough starts. Remember, one of the very important remedies, I would say the first important remedy is phosphorus, and second, you can think about Merck Idoflavus or sulfuric acid. But again, phosphoric acid, cough from strong odors, very, very important. So this is something about the cough. Of course, it is written in a material, rattling cough while eating. And how much is the rattling? The rattling is so much that it shakes the whole body. पूरी बॉडी हल जाती है खांसी को, इतना ज्यादा खांसी पूरी बॉडी हल जाती है. So rattling cough which shakes the whole body is again an important symptom of phosphorus cough. Now this is what symptoms I have seen in phosphorus. Now you have to see in phosphorus what is the expectoration. In phosphorus it is written in a mathematical expectoration in bed. Patient बोलता है जब मैं सो के उठता तो मेरे को बहुत खांसी निकलता है, पूरा बलगम निकलता है, very close to calcarea cough, expectoration in the bed. This is phosphorus. And when is the expectoration more? I told you, loose cough while eating or loose cough after eating. So expectoration कब रहेगा? Very simple, expectoration after eating. Whenever if you get the symptom, my dear friends, think about phosphorus. Second, think about lycopodium when the expectoration is after eating. In phosphorus, whenever the patient gets up in the morning, the color of expectoration in the morning is so important. The color is white. Phosphorus has different type of expectoration, different types of color and different modalities. So in the morning, expectoration is white. Remember phosphorus, kali bichrome, natrum mure, sulfur, agaricus or alumina. These remedies are expectoration in the morning. And in phosphorus, expectoration sometimes is basically in brownish lumps. That's important. So phosphorus and Agaricus muscarius. This is a very important symptom of brownish lump because it is present in two remedies, and the first important remedy is phosphorus. Next, in some cases, my dear friend, if the patient tells you that expectoration is like lemon, नींबू के समय expectoration आ रहा, वो भी phosphorus रहता है. So it will be phosphorus, lycopodium and pulsatilla. We normally think about pulsatilla because the yellowishness is there, but do think about phosphorus also. This is very important. And sometimes the patient tells you, कैसी जब खांसता हूं ना तो ऐसी मिट्टी के समान थूक निकलता है, ऐसे गंदा काला काला सा। तो सो दिस इज ऑल्सो फॉस्फोरस, एक्सपेक्टोरेशन एज इफ मिक्सड विद डस्ट. If this is the case, then think about phosphorus, Nux vomica and creosote. If you have watched my video of creosote cough, I have put in my YouTube, do watch that creosote cough. So we have different types of expectoration. After eating, white colored in the morning, lemon colored, brown lumps and as if dust. So one of the 5, if you see, you can think about phosphorus. And of course, then the next part of phosphorus is expectoration. Sometimes is like bloody, thin blood comes out in the expectoration and rusty taste in the mouth. This is very common symptom in phosphorus. As you go further, after expectoration comes the taste. The taste of phosphorus patient is very important. It is seen that expectoration tastes like urine. So it is so much offensive of phosphorus. So urinous expectoration taste is phosphorus. Again, Seneca comes very close to this. That is phosphorus expectoration, the taste of expectoration. Sometimes the taste is clay-like. Sometimes the taste is putrid. Sometimes the taste is like old cheese. And one thing I've seen in about 2 cases where the expectoration tastes like orange. My dear friends, expectoration tastes like orange. That is also phosphorus. So we have told you cough of phosphorus, the expectoration of phosphorus, and how does the expectoration tastes in phosphorus. This is just regarding the cough part and the expectoration part of phosphorus, what I've seen in this pandemic, which has helped me to treat a lot of patients and get a lot of good results. In further videos, I'll tell you further remedies that I have used clinically. I can give you a lot of charts and charts when to use when Mater Medica type, but this is plain Mater Medica. Clinically, what you have seen in your practice, that is very important. So my dear friends, if you like this video, do share and subscribe. Thank you.